Hey there, I just wanted to make a video about my experience with getting a discectomy of my L4 and L5 lower lumbar from a herniated disc that was on my sciatic nerve. But first let me tell you about what's motivating me in making this video. First of all, I've discovered that there is a whole community of people on YouTube who are posting their experiences of even the day of surgery and the day after. Well, I'm just discovering this 10 days post-op. So one thing I found was a lady who is a heavy weightlifter, and her experience has been amazing, and seeing her and kind of comparing notes on what her symptoms were and what her restrictions were, which really kind of eased my anxiety of, okay, what I'm experiencing is normal, I'm not alone in this. And seeing her a year later back to lifting and back into the gym makes me like not just kind of hope, but absolutely be convinced that I can get back to the gym myself. Live a healthy, active lifestyle where I work out 5 to 6 days a week, and I have an office job. I'm a counselor and I sit for about 6 hours, 7 hours a day straight, so it's important for me to be able to work out during that lunch break. So that's what motivated me. I hope that this will be helpful for you too. So let me give you a little bit of history. I have a history of getting just kind of back strain about twice a year, where I've learned through physical therapy that I just do these back inflections, and that has helped me just kind of like, I would stop working out for anywhere from 2 days to a week at the most, and then I would be back on the horse. So I also know my triggers, and that is sitting on road trips. Road trips are a big trigger for back strain, and also just like poor form in the gym. So, and not stretching. So with that being said, I was on a road trip back from visiting family, and this all started on August 21st, coming back. And so that pretty much laid me out for the next 3 or 4 days out of the gym, as I was icing my back and kind of getting it back to healthy. I did a workout on the 26th, felt great, but I still felt sore, which is unusual. So I rested over the weekend as well, which continued all the way until my first workout, which was on September 2nd. That's the longest time I've been out from just simply back strain. Very unusual. So then that weekend I also rested some more, and by Sunday morning, on the 2nd I did the workout that I did was just an upper body workout, and it didn't make anything better or worse really, so that's why I rested on the weekend. Well, Sunday morning I woke up and I could not get out of bed at all. My husband had to help me. I had a whole new symptom of, which now I understand was sciatic pain, and my disc had herniated in my sleep. So there was no particular movement that triggered it that we can figure out. So I had the pain from my lower back all the way down my left leg to my knee. It felt just like electricity, and it hurt to even get up, just the motion. So my husband, I had to like be really stiff as my husband would help me up. He had to help me dress, go to the restroom. Getting in and out of the car was nearly impossible. So I had to call in sick that whole week, and then it was just really just a horrible experience. I went to physical therapy twice. They were having me doing these flexions, basically what I've done in the past, but very like kind of baby version. We're just tolerating laying on my stomach, and just the having my arms here and then just kind of under my body. But at home I could not do these exercises at all. In fact, it was kind of dangerous, and that's the only thing in my whole journey that I would have done differently, is I really would have advocated for myself that didn't feel right. And it was really, really, really difficult to do at home. And yeah, so I was doing my exercises on Friday the 9th, and I was getting frustrated, so I stopped and I was trying to get up, and I was on my sciatic nerve. I didn't understand that at the time, but I was just like, oh my goodness. So I was on my sciatic nerve. Oh, kind of going back to that, on Sunday the 4th, I went to the ER. They gave me an x-ray, and they just gave me some pain meds and said, you might have a herniated disc. Come back if it gets worse. So, totally unhelpful. So then on the 9th, I was trying to get up from this move, and I was on my sciatic nerve, and I was just like really, really crying and upset. And my husband, just trying to be helpful and reactive, he grabbed my hips and just shifted me off. Well, that was the worst thing that he could have done. My pain then got 10 times worse, and it shot all the way down to my foot. It was like hot lead, hot molten lead, just screaming down. I could not move my leg. I couldn't put any weight on I couldn't walk. I couldn't put any weight. We had a neighbor let us borrow a walker. It was horrible. And mind you, I was on the muscle relaxers and the heavy pain meds at the time. That evening, I needed his help to go to the restroom, and he went upstairs real quickly, and I went, honey, I think I'm going to faint. My face felt really cold, and I was just dripping with sweat, and passed out. Next thing I knew, he was carrying me to the couch. My teeth were chattering like I was freezing, and later I found out from the ER that I was actually going into shock from the pain. So that says a lot about how much pain I was in. I'm a tough cookie, but that was horrible. So we went to the ER Saturday morning after talking to my doctor, and the doctor said, you need to go back to the ER. So we went back to the ER. They did an MRI, and here's my MRI. So as you can see, it's pretty, I mean, they called it severe, and it is. It's right on my sciatic nerve. And so imagine any movement just knocking that down on my L4, L3. So they immediately did a referral to a neurosurgeon, and I have to add, throughout this whole journey, it's been absolutely amazing how God has just opened up appointments. I did everything. I did acupuncture, I did white willow bark and turmeric and natural anti-inflammatories. I did prescription medication, massage, and truly everything. And God was just so amazing in how he just would open up appointments, and it just fell into place. I applied for short-term disability through work because I didn't know if I was going to be back to work in the next 2 weeks or 2 months or what. Things were just getting worse, and as it got worse, it seemed like more and more doors were opening. It's pretty amazing. So, as in hindsight, and anyway, so we met with a neurosurgeon. He said, you're a great candidate for surgery because you're young and healthy and fit. You will respond very well. This is a very clear-cut surgery. It's just kind of in and out. But also, we also don't like cutting into young and healthy people. So we decided to do a steroid shot, and physical therapy stopped wanting to work with me because everything was just too painful. The hope was that the steroid shot would calm things down so that we could actually try to make some headway. The steroid shot experience was absolutely horrible. They didn't know how severe it was, I guess. I don't know, they forced me onto my stomach really quickly, which zinged my leg all the way down to my foot, worse than ever. Almost as worse as when it got worse, if that makes sense. And I'm crying, and then they lift up my leg, which made it worse again, and then I'm like, just get this over with. They do the shot, feels like 2 golf balls. I felt everything. They're like, oh, this is going to numb you. I felt everything. Horrible experience. On Friday, the neurosurgeon called me back to check on me, and I felt worse than I did before. He said that wasn't a good sign. Most people feel a little bit of improvement, even though it takes about 1 to 2 weeks to feel the full effect of the steroid shot. So we kind of went over my options, and he said, look, I can fit you in for a surgery on Monday before I leave. He is going to be gone for 3 weeks. And so he's like, you can either wait it out in hopes that the steroid shot will give you some relief while I'm gone. If it does, great. If it doesn't, then you're stuck for 4 weeks in this pain until we can get you in. So I told him I would call him back, and I just talked to my husband, and we prayed about it, and we really felt like this was another door that was open for us, and I did not want to live in this pain any longer. And I also wanted to just get back to work, get back to life. And I didn't want to postpone it another 4 weeks. My gut said that the steroid shot was not going to get me to the point where I could drive myself. And my husband needed to be able to get back to work. So we called him back and we scheduled surgery for the 26th, right after my niece's wedding. I told her I would get helicopter there if I had to. I don't even know how I made it. Oh my goodness. In retrospect, goodness. But again, it's just like amazing. If he would have said, oh, the surgery before the wedding, I wouldn't have been able to go on. I mean, just everything worked out so perfectly. Anyway, so I got the surgery done on the 26th, and on Tuesday, I left at 10:30. The only thing I can say about this surgery is the worst thing about it is just those moments leading up to it, and just kind of like, there's some anxiety of the unknown. But I'm telling you, when I woke up, I wanted to just cry. Not because of pain, but because the pain was gone. The pain that I was living with, that was disabling me, was instantly when I woke up, it was absolutely gone. It was amazing. The only thing is just the tenderness of the incision, which really is just like the size of my pinky, or just like knuckle, like less than half an inch. And nothing, just a little tender, that's it. I walked out of the hospital. I got into the car on my own and out of the car on my own. It was like, I felt like a toddler, like, look at me, I can get in the car, look at me, I can lay down by myself, I can get up by myself, look at me, and I can dress myself, which was a little tricky, because the post-op instructions are that, which is pretty standard from other videos that I've watched, is BLT, no bending, lifting, or twisting. The hardest part of no bending or lifting or twisting is not that it's painful, it's not, but that it's habit. So, you know, like even just like putting on your seatbelt, you want to do this, which twists your body, so you have to like grab it and do this. Like little nuances like that. Getting in the car, you have to like get in like this, and then move your whole like shoulders and hip have to be in line. So you basically have to keep your back into a neutral position at all times. And I think I'm pretty good at it, but it's still, I mean, I accidentally picked up my daughter once when she was having an accident by the potty, and I just saw her, and I'm like, oh, I just kind of picked her up and put her on. I lifted and twisted, and I'm not supposed to lift anything more than 10 pounds, and she's 30 plus. So, big, no, her eyes got big, like, Mommy, you're not supposed to do that. I'm like, I know, that was a big no-no. So as a parent, it's really hard to not parent. I mean, that's the thing. The two hardest things is not being able to parent and hold my daughter and pick her up, and not working out. Oh my gosh, and just like being active and having that release. So, but I'm on the road to recovery, and I am just following all the instructions by the book. The only symptoms I have post-op, I've heard that some people, my surgeon warned me that you'll have these kind of phantom sciatic pain. I haven't had any, maybe a little bit on the lower back towards the left, a little like pressure, like someone's kind of putting their thumb on me, but that is not very often. And it's usually if I've been just kind of standing too long, and I'm not supposed to sit for more than 30 minutes at a time, so that might make it feel that way. But then I kind of walk and it gets better. That's the only thing I felt. I'm assuming that's only going to get better. I also get these like lower back muscle spasms, which aren't painful, but just weird, kind of creepy feeling. When it's cold out, that happens, or just randomly it happens. So I'm also assuming that that's just kind of part of the healing process. My post-op appointment is September 3rd, or October 3rd. So I'm excited for that, and I'm going to write down a bunch of questions for them. I'm hoping that they're going to okay physical therapy. They don't want me to do physical therapy right now. So, so hopefully I'll be able to do that and get back into the game. I go back to work on the 14th. So I'm happy to hear that, and miss all of my patients and all my coworkers. So I think that's all of it. Yeah. So if you have any questions, just post, and any questions about the surgery, Dr. Lando was amazing. Or anything about my symptoms or recovery so far. I'm open to answering those questions for you. I hope that this eases any anxieties that you're having, and that my journey may parallel your story in partway or wholly. But yeah, that's it. My only advice would be it's okay to ask for help. Ask for help. We've had a lot of people come forward and just help us out with meal plans and whatnot. So that's about it. I hope that this is helpful. And maybe I'll post again after, actually I will post again after my post-op appointment and let you know what they told me. I think that's it.